Hello, everybody. Welcome back to How Come. I am so excited, and not just because this episode is fantastic and with a doctor, which we love, but a doctor recently brought a new member of my family into the world the other day. Welcome, Oliver Joel Casimir, to Earth. We hope you like it. My brother and his wife, congratulations, had their baby. So Charlotte and I are now aunties, and we're so excited, and he's so cute, and he came early, but he's okay. Baby's okay. Mommy's okay. Everyone's doing fantastic. And now I have to plan my travel back to New York a little earlier than I thought. So I'm going to start planning that, plan my little quar to meet the guy. And I'm so excited. Before we get started on this episode with Dr. Brighten, who is fantastic, we're going to be talking about hormonal health. We're going to be talking about naturopathic medicine, different ways to heal, PCOS, which is a post-birth control thing that can happen to you or thing that you can get misdiagnosed with. We're going to talk about all that. But before we do that, since I have a doctor on this week, I just wanted to talk about the most misogynistic article I have read in a really long time, which was published by the Wall Street Journal this week, with this writer, Joseph Epstein, calling out Dr. Jill Biden, our incoming First Lady, about wanting her to drop the doctor in her name. I'm just going to read you some of the article, and then you can go read the rest of it if you need more evidence that this person is a complete asshat. But the article starts, Madame First Lady, Miss Biden, Jill, kiddo. A bit of advice on what may seem like a small, but I think is a not an unimportant matter. Any chance you might drop the doctor before your name? Dr. Jill Biden sounds and feels fraudulent, not to say a touch comic. Your degree is, I believe, an EDD. A doctor of education. Notice how he said doctor. Fucking idiot. Earned at the University of Delaware through a dissertation with the unpromising title, Student Retention at the Community College Level, Meeting Students' Needs. A wise man, of course, once said that no one should call himself doctor unless he has delivered a child. Think about it, Dr. Jill, and forthwith drop the doc. And then I think the rest of the article is just him being like, yeah, and I was a teacher at college and I didn't even have a doctorate. And it's like, okay, sorry, you're dumb. Yeah, I don't know. I don't really have anything to say except for that this man is a stupid misogynist who needs to shut the fuck up. And I wonder if he asked Henry Kissinger to drop the doctor too, because he was a politician that used doctor and I don't think he delivered any babies. So shut the fuck up, Joseph Epstein. Go get therapy and leave the rest of us alone. This episode is going to be amazing. We're not going to be talking about him at all. We're going to be talking about healthcare, and we learn a lot. Thanks to Manscaped for supporting How Come. Manscaped is the best in men's below-the-waist grooming, offering precision-engineered tools to provide you with the best experience. To get 20% off and free shipping off your order, use promo code HOWCOME at manscaped.com. Also, thanks to Dipsea for supporting How Come. Dipsea is an audio app full of short, sexy stories and guided sessions designed to turn you on and help you get in touch with yourself. Get a 30-day free trial when you go to dipseastories.com/howcome. Finally, thanks to Satisfier for supporting How Come. Satisfier just released new app-enabled vibrators. Get 25% off of all app-enabled devices when you go to satisfier.com and enter code HOWCOME25 at checkout. Okay, this episode is going to be rad.
How come? How come? How come I can't achieve? How come I can't achieve? I'm rolling up my sleeves. I'm rolling up my sleeves. Oh baby, I believe these guests can help. 'Cause I can't do it by myself. I wanna jizz.
You guys, I am so excited for this week's episode. Dr. Jolene Brighten is a prominent leader in women's medicine and the emerging science of the post-birth control syndrome, studying the effects of hormonal birth control on female health. So please give a warm welcome to Dr. Brighten.
Hey there. Thanks so much for having me.
Thank you so much for being here. We did an episode last season about periods. And on this episode, we're going to be talking about things that your period can be signaling in terms of your health, as well as naturopathic medicine, which you practice. So could you first explain what naturopathic medicine is and what is the difference? Like, what makes the naturopathic medicine approach different than conventional medicine's approach?
So when you go to naturopathic medical school, you're trained in both conventional medicine and what gets called like alternative medicine. So the diet, lifestyle piece, looking at herbs, looking at nutraceuticals. And so what I'm really trained in is how to navigate the space between, like, I have a DEA license, I can prescribe drugs when they're needed, but I can also look at drug nutrient interactions, so drug herb interactions, so that I make sure that people, because people go to the health food store and they do what they do, but to be able to counsel in that way. And what I'm always looking for as a naturopathic doctor is the why. Why do we have this? What's the root cause of this? And how do we address that? Will we also make the person feel better in the short term? And if I am going to prescribe a pharmaceutical, that's with the patient's informed consent, but it's also always in my mind, and a conversation I have with a patient is this actually addressing the root of what's going on? Or is this only addressing the symptom? And what is the plan to get you off of this? Like, is this going to be something? So for example, if it's something that, like, we are going to be prescribing you thyroid medication because you have Hashimoto's, your thyroid's been destroyed to a capacity that it cannot produce that, we may not be able to get you off of this medication. This may be a lifelong medication. However, there's so much more that you can do to manage this. And I want to empower you and inspire you and remind you of your capacity to actually care for your own body. Yeah. So essentially build a user manual to your own body. And, you know, but on the other side, if it's something where it's like, you're having period problems and you want to start the pill, for example, I'm going to tell you, like, this is symptom management. So we're managing your symptoms right now. We're going to just basically take away your period. We can also work on these other things while you're on this, and then talk about transitioning off at a later date. So for example, this is one that, like, comes up is, like, you're going to be graduating, or you're going to be, having a wedding, like, you're going to be in photos and you don't want to have acne, and you're like, just give me the birth control, give me the spironolactone, like, just make my skin clear. Okay, we can manage that symptom. And then also let's make sure that we're working on your gut health. We're working on your diet. Like, we're working on other pieces as well. And so it's really, you know, the marriage of these. And so some people call it holistic. Some people call it integrative. There's a lot of names, but it's looking at you as a whole person, understanding what's unique to you, how we need to uniquely address what's going on for you, and how do we resolve the root cause of things. So essentially you don't need me. So
that's good.
And that's really, you know, I say so often, like, I don't heal my patients. I teach them how to heal themselves, because
that's nice.
When it comes to your condition, it, you know, doctors take so much of the glory. But what I say to my patients is, I'm not there in New Seasons with you, right? I'm not there in the grocery. I'm not there
Portland plug.
when... I'm not there when you, you know, when you decide to stay up all night partying. I'm not there when you pass on that alcoholic beverage because you know it doesn't make you feel good. You know, I'm not there for so many. You are doing all of that, and you are taking steps towards your health. And I'm more like hey, here's the roadmap and I will guide you. Yes, I have a responsibility to, like, oversee your healthcare, to run your labs, to do all of these things. And yet the majority of healing really happens outside the doctor's office. And that is something that we have to be reminding people. And so that's a big difference. In naturopathic medicine, we want to remind people of that, the power they've always had to heal their body and to work with their body. Whereas I see, you know, on the flip side, I have many friends who are conventional doctors who I don't want, you know, you guys know I love you, but they'll know this to be true, that there are many doctors who are like, it's full ego. I heal you. I am like in this godlike state where I, like, orchestrate all of this and I make you better or not. And I think that that's a big philosophical difference, is that my belief in you and my belief in teaching you to really take hold of the reins of your health.
I love that. It's also like a therapist. You could never say, oh, well, I healed you. It's like the patient had to come in and said, I need healing. And they also had to do that in their off time too. So I love that. I love the patient taking back like that ownership of healing themselves with somebody who knows how to do that with them and has studied and can like give you good information.
Yeah.
So we haven't talked about the post-birth control syndrome, PCOS, at all on this podcast.
Oh.
Yeah. So we know that people have been misdiagnosed with it. We know people have been undiagnosed. So can we just explain what that is for people and what a real diagnosis actually looks like?
Sure. So PCOS, or polycystic ovarian syndrome, has a really horrible name. It makes everybody think that you must have cysts, which is not totally true. And your cysts aren't really your problem. What's really going on is a complex metabolic issue. So in a nutshell, it's important for women to understand that it is a complex metabolic disorder that has reproductive hormone side effects, essentially. So PCOS, to get the diagnosis, and if we're going off of the Rotterdam criteria, yes, we can have those polycystic ovaries, but you only have to meet 2 out of 3. So that's 1 point of the criteria. There is generally issues universally seen with testosterone. So this can be a little bit confusing because you don't always have to test for it. You can see it. So if you've got cystic acne, oily skin, hair loss on your head, your growing hair on your chin, chest, abdomen, those are signs of high testosterone. So sometimes a woman's doctor will just say, well, we saw it, so we're going to confirm it that way. But you really should have testing because PCOS is more of a diagnosis of exclusion. We have to make sure nothing else is going on. So when we say diagnosis of exclusion, it means exclude other probable causes before just jumping into PCOS. But as we know in women's health, lots of things get jumped to, and so I just want women to know that if your doctor jumped there without doing tests, you may need to have testing. And the testing for PCOS, to meet that piece of the criteria, we want to look at testosterone, but in women specifically free testosterone. I also like to look at DHEA, and we like to look at DHT, which is a really potent form of testosterone, just so we have the full picture. If you look at just a total testosterone, you may not see what's really going on. Free is what's bioavailable. So we want to be looking at that. And then the third piece of the criteria is the metabolic piece, which is insulin dysregulation, blood sugar issues. So we're going to be testing for, some doctors will test for hemoglobin A1C only. Other doctors will test for a fasting glucose only. Fasting glucose is really worthless in my opinion, if you're not coupling it with also fasting insulin, looking at a hemoglobin A1C as well to understand what is going on with that metabolic piece. And not every woman with PCOS will present with being overweight or present even with insulin dysregulation. I mean, I find a lot of times in my practice, we're ruling everything out. And I'm like, this looks a lot like PCOS. We don't have the polycystic ovaries. We don't have insulin dysregulation. But you eat a diet that is rich in plants, and you have a high quality protein and fat, and you're weightlifting and exercising, and you're doing all the things that we would prescribe to manage that piece anyway. So sometimes that makes it tricky, is that you're living a lifestyle that would essentially be managing the condition. And so we won't always have those findings. So it is not a hormone imbalance at its core when we're talking about sex hormones. If you're talking about insulin, yeah, we've got that imbalance, but there's something more to it. And unfortunately, within the United States, we just don't really feel that women's health deserves that much funding and research. So we don't know. We got 1 in 10 women walking around with PCOS, and people are like, well, what's the root cause of PCOS? I'm like, well, insulin dysregulation, inflammation. There's the dogma theory, which is all about gut health and is there imbalance in gut flora. There's a genetic component. But for us to say, like, this is the one thing, we're not there yet. Could we be there right now? Possibly, but
if there had been more studying throughout time
and listening to women.
Yeah.
I mean, that's like a huge piece of all of this. So, anybody with PCOS who's listening to this right now is no stranger to you have irregular periods, let's just put you on the pill. And nobody even asks why. Or you have irregular periods. Are you trying to have a baby right now? No. Okay. Let's just put you on the pill. That will fix your periods. For people listening, I'm doing air quotes because that's not how any of that works.
Yeah.
It doesn't actually fix your periods. And then even once you get the diagnosis, it's often like, well, let's put you on the pill. Let's get you on maybe metformin. If you've got significant acne, we're going to get you on spironolactone. And there's no, and those things have a time and a place. I've prescribed them. I'm not anti-pharmaceutical by any means. If you need a drug, you need a drug, and thank goodness we have them there.
And thank goodness for doctors who write our scripts.
Right.
My dad called in my Lexapro last week. Thank you, Father.
Oh, I know. It's something where people will sometimes say, well, like, of course you're against pharmaceuticals. And I'm like, so happy to have my thyroid prescription every single morning.
Yeah.
I don't function without it. I have a son who has a complex autoimmune condition that affects his brain. So whenever people are like, oh yeah, you must hate pharmaceuticals. And I'm like, if it wasn't for prednisone, I wouldn't have gotten my son back.
Yeah.
Like these things they all have a time and a place. I just don't get down with the doctors who are like, drugs and surgery are the only way.
Right.
Or the doctors who are like, diet and lifestyle are the only way. And I'm like, can we just marry them?
Marry them. It's literally like the like male porn and rom-coms. It's like neither of those two are right. Marry them.
Yeah. Listen to that. Neither one is totally satisfying, and it's like missing elements.
And neither one is like lacking everything. Like they both have good stuff. Marry them.
Married. I love that analogy. I often will use the analogy that like when it comes to medicine, I want the buffet. Like I'm like a tapas person or like a buffet. Like I don't want a whole meal of like you just have to eat what's in front of you. It's like what
it's the Mariah Carey diet. She's always like, you can have everything you want, just like a tiny bit.
Yeah, just a little bit of everything, what you need. But the problem is that when women with PCOS, they're only given prescriptions. They're not told anything about their condition, or worse, they're not even diagnosed because they're just given prescriptions. There was a study that came out saying that it can take more than 2 years for a woman and she has to go to subsequently 3 different medical professionals before she even gets the diagnosis of PCOS. And I had this on my Instagram the other day, and the number of women who are like, it took me 10 years, it took me 12 years. Actually, I've been doing this my whole life. I'm in my late 30s now. And like, I just figured out what was going on. Like that's an issue because we're not listening to women. We're not doing our job in working them up. And we're just being like, you can't blame a doctor for being like, I just want you to feel better right now.
Totally.
But yeah, like we want you to feel better. We can do that symptom management and also investigate what's going on. And so with PCOS, yes, we've got pharmaceuticals that can help. They work way better if you're also bringing on diet and lifestyle, but it's also a condition that in many instances can be managed with diet and lifestyle. And it all just depends, because if you're listening to this and you're like, right now, like, no, I'm gaining weight, I have all this acne, like I want my drugs. Great. We can use those, but you don't have to be on them for the rest of your life. Like there are ways that we can work with that. And it's really about really designing a plan that's for that person in front of you. Because the other thing that I find a lot in the wellness space is that people are like, but you can do everything with diet and lifestyle and it can be so wonderful and but it's like, okay, well, one, we've got issues with access to food. There are socioeconomic issues that we have to look at. And then there's also people who just don't want to do that. And we don't need to shame them, because if you're like, I just don't want to deal with that, and I just want to feel better. Control, then do it. Like that's my job as a doctor, is just to support you. I tell you all your options. You make your choice. I make sure I monitor you. I tell you what to look out for.
And tailor the system to you specifically and like your body and what works.
Absolutely.
So there are a lot of women being misdiagnosed with PCOS then.
So there's a lot of women who are not being diagnosed. And then there are women who have been misdiagnosed. So I had a doctor when I came off the pill after a decade on it. For everybody listening, I come from a huge Hispanic family. Everybody has 3+ children, and nobody has a college degree, or let alone as a doctor. So for me, using the pill, I was like, yes, well, it was initially, yes, I don't have to have like the wicked, horrible periods that have been told to me that that's just what's normal. I found out later in life that I could totally manage that. It didn't have to be that way. But I also was like, I can go to college and I can get a degree and I can not worry about getting pregnant. Like these are wonderful things. But when I came off, I lost my period for the first time. I mean, there are people who are like, but you never had a period the 10 years you were on the pill. I'm like, okay, true. But I did have these wicked, well, it's not a real period when you're on the pill. It's a medication. During the time that, and I'm like totally dating myself that I was on the pill, the continuous pill came out too. My doctor's like, you never have to bleed. And I was like, yes, sign me up for that. So they have like, they have continuous pills where you like only bleed 4 times a year. So,
what was like Seasonique?
Seasonique.
Yeah.
What a clever
I remember
name,
when
right?
that came out.
Yeah, it's so interesting because like I even remember like being at the gym, warming up on a treadmill and like reading in like Cosmo or something like about this. And it's kind of a trip to me that I'm like, I was getting more information from Cosmo about birth control than I was getting from my doctor's office.
That's crazy because Cosmo.
That's weird.
Now they give good advice, but before it used to be like warm up an avocado in the microwave, stick it up his ass and drive him wild.
If anybody ever tested that, I want to know in the comments. You got a comment below. That's right. I don't know if you watched the show Big Mouth. Oh my God, I love
I'm
that
obsessed.
show.
I was going to recommend that to everybody because this season.
My proctologist is never going to believe I didn't do this to myself. I was dying. My friends who are in proctology are like, you would never believe the things I've seen. I'm like, oh, see, but like, I'm looking at the vaginal canal. You would never believe the things I've seen. Like, they're
war stories.
It's also like human curiosity and exploration. And I've gotten, so many women who are like, I came to you because I don't want my doctor to shame me. And I'm like, there's no shame, but also if you want to try stuff like that, give me a call. Let's just talk through it. Like before you're putting like produce up there, it seems like a good idea when and to be fair for everybody listening, when you are in the mood, your brain gets flooded with chemicals that are just like, let's not think. Let's just do whatever feels good.
Let's be crazy. Come here, carrot. Yeah, it's like at this point, I understand the household items things back in the 90s. Like we didn't know, we didn't have the internet, we didn't have any other options maybe than a carrot without a stopper. But we have options now. We have so many options to mix up our sex lives and do fun stuff when it starts to feel stagnant or repetitive. And like, no matter how much we appreciate our partners, having the same type of sex day in and day out can start to feel boring. So you might want to spice it up, right? Good news, Satisfier has just released new app-enabled vibrators that allow you to spice things up safely. Nothing's getting lost. With their vibes, you can take control or give up control, whether it's with somebody in the room or somebody on the other side of the world. So if you're alone right now, your sex life does not need to suffer. Satisfier's new line of app-enabled vibrators allow you to personalize your own programs. You guys, you can really tune into your own personal pleasure. This is something I've been wanting to do for the longest time, is make my own programs. So if you want to connect with your partner's pleasure even more, even when they're away, Satisfier's new app actually utilizes distance as a way to heighten intimacy. With the Satisfier Connect app, you can control each other's pleasure devices and see each other's responses in real time. The app is a great way to stay connected with your significant other or anybody that you're like chatting with. And maybe you're not ready to like get in person, but like this could definitely be fun. As I said, you can personalize your own programs. You can you probably already know the program that you would and like the pattern and the setting that you would want to use. Also, there's a haptic touch control, which makes it intuitive and seamless during your experience. Satisfier Connect is the live control option that allows couples to refine their experience together with accurate precision within a moment-to-moment context. It's a super fun way to use the device with minimal effort. This type of personalization option can be a huge confidence builder for singles or couples wanting to understand what specifically turns them on. Because like if you're telling a device instead of the person, it's like, this isn't personal. This is just like what I like. The app is a great way to stay connected with, like I said, your significant other or an insignificant other. Also, you can do it to your favorite song. This is the best part that I have enjoyed too. I always wanted to make my own pattern, but I always was like, oh my God, to music, it would be amazing. There's a music play feature. It allows you to connect to Apple Music or Spotify, and your connected device will respond to the beat of the music. If your favorite song is your lover's voice, their ambient sound feature will pick the vibes of their voice. You never have to worry about a dead battery in the middle of a session. Once you pair your Satisfier Connect app with your device, you will always be able to see the battery life, which is something that like I really like, because there's nothing worse than when it's like you're like reaching like the drop in the song, if you will, and then it's like cuts out. Just all the music turns off. It's everything I've ever dreamed of. So go get 25% off all app-enabled devices when you go to satisfier.com and enter code HowCome25 at checkout. Again, if you're looking for one of our favorite new devices, go to Satisfier, SATISFYER.com and enter code HowCome25 for 25% off. And if that last thing made you feel lonely and you were like, I don't have anyone to do stuff with, that's okay. I got you. A lot of people feel alone right now. Holiday season especially can bring out feelings of stress, anxiety, loneliness, this year more than ever. And when you're feeling overwhelmed or you're feeling lonely, pleasure is often the first thing that gets overlooked, and we can't have that happening. We need to make your sexual wellness a priority with Dipsea. Dipsea is an audio app full of short, sexy stories designed to turn you on and keep you company. Each Dipsea story features characters that feel like real people, and they have immersive scenarios, so you feel like you're really there. You can find stories about an off-limits hookup with your professor, or a costume party that takes things to the next level, or maybe a story where your partner tells you exactly what to do, or you try a new toy together. They release new stories every week, so there's always more to explore no matter what you're into or what turns you on. They also have wellness sessions, so if you want to learn more about yourself, or you need bedtime stories and soundscapes to help you relax before you drift off, they have that. They're also launching a new section of content geared towards bedtime and winding down. It's called Sleepovers, and it features popular Dipsea characters speaking directly to the listeners to say goodnight and tuck them in. They're meant to feel cozy and comforting, and the sounds of the characters stay near as they grade papers or play guitar softly while you drift off. It's literally like it's company. Bedtime Stories features the classic Dipsea storytelling, but less explicit, that let your mind wander. They also have soundscapes, which feature calming sounds to drift off to that are focused on sounds rather than just story characters, like ocean waves or rain. I love the soundscapes so much. I have trouble going to sleep sometimes if like my mind is racing, and those can, like, if masturbating doesn't do it for me, I usually need some audio thing to like just like supplement or like replace the anxiety in my brain, and Dipsea is perfect for that. It's a great way to get in the mood, spark your imagination, connect with yourself, or just relax. And for listeners of the show, Dipsea is offering a 30-day free trial when you go to dipseastories.com/howcome. That is a 30-day free trial when you go to DIPSEA stories.com/howcome. You're going to love it. Okay, let's get back to Dr. Brighten.
I just feel like, I'm like, this is like, we should just have like guests calling in of like, what's the strangest thing that
Truly
you've ever found pleasure from? Yeah, but avocados in the bum, not such a good idea, because those pits, it's
there's no stopper. No, Cosmo used to be bad with sex advice. Now that, I mean, I'm glad that they gave birth control advice.
Well, that's where I found out about Seasonique, and
Okay.
I found, this is like, so there was like a whole ad, and there was like a whole thing about it. And that's when I went to my doctor, and my doctor's like, yep, you don't have to have a period. I'm like, okay. And I remember just being like, I mean, there was a point in my 20s where I was like, well, I could just basically say you'll bleed when I say you bleed. And my doctor's like, yeah, that's probably fine, because it's not a real period. Mm-hmm. Although it does make me, but here, we don't actually have any studies on what happens when we do that. Like, we don't actually actually know, because for the most part, medicine views the women's reproductive tract as just like this negotiable thing. Like, we could take out your uterus, you need it, you don't need it. And I think a lot of that becomes down to, like, we do go through menopause, the ovaries do call it quits at some point for most of what, you know, they're putting out in terms of hormones. But a lot of it is also born out. I mean, we have to be real. It's born out of the fact that, like, medicine didn't even consider us. We're just like the lesser of the male body. That's really how the origins of medicine. They're just like, there's this beautiful male standard, and then there's this like icky thing over there that like makes babies and like does
that
stuff
like
and like
made all of you.
Yeah, that like basically births every single one.
And we're not going to study that one, and we're not going to know what the internal structure of the clitoris is until
Oh
1998.
yeah, I know. Like, how long did that take? Because like we cannot be dissecting women and exploring that. And you hear a lot of people, like the whole G-spot debate, and people, it's like people get so, you know, in medicine especially, people just get like so egotistical and self-righteous and shamey, and they're just like, someone says the G-spot and they're like, that's been disproven, that's not real, you're crazy for ever listening to that. And I'm like, you're not crazy for not having all the information. And also, like, your clitoris is like this giant, almost octopus creature that like nobody ever taught you about that. And we just like figured this out not too long ago. Or even the nerve endings of the clitoris, like just not even understanding that. Yeah. And to think that like, oh, we're just so different. And how much society is set up that like, you know, female anatomy is to pleasure male anatomy.
Right.
And then like they'll do the things that we're talking about, like just like throw medicine at you to like clear up the issue or like make everything okay. So you were misdiagnosed with PCOS.
Yeah, so that was when I came off the pill.
Okay.
I broke out in cystic acne. I lost my period, and my doctor said, you have PCOS, and really never worked me up, never looked at anything to really do the diagnosis. And I was like, I don't have PCOS. And at the time I was in medical school, and I was like, I don't have PCOS. This is not the criteria. This is not to make the diagnosis. And I never had irregular periods. And this is important because PCOS women, they've always had irregular periods.
Okay.
They never had like 3 years of like perfect predictable periods and then one day they're regular. That's not the way PCOS works. It's really like from the get-go, like brain, ovaries, everybody's misfiring and not doing their job appropriately. And so it is possible to also get misdiagnosed with PCOS. Sometimes doctors do an ultrasound, and that's the only thing they do. And they say cysts on their ovaries. The younger you are, the more likely you are to see these. And they're not really cysts, they're follicles. They're your ovaries trying to work really, really hard to make an egg. And so the younger you are, the more likely you are to see those. You cannot diagnose PCOS based on that alone. And the older you are, the less likely you are to see those. And so you can't, it's something where doctors will say, well, you didn't have any of the classic is the strand of pearls is what we see. It looks like a little strand of pearls in the ovaries. And they'll say, oh, well, you didn't see that, so there's no reason to do more testing. No, this is the thing. If you don't feel right in your body and your doctor's like, well, one lab was fine, that's not sufficient. Like, we need to go digging. We need to understand further what is going on.
We need to have a recount.
Recount. I need a recount. Well, I need you to actually actually collect the data in the first place. But there's there's also optimal ranges that we have to be looking at. So let's say sometimes, and we'll just arbitrarily throw out that they say, okay, the diagnosis happens at 50, but you're at 49, so we're not going to worry about it. And it's like, well, that's like close enough. Okay, it's close enough, and I've got all this other stuff going on. And rather than flipping into 50, how about we look at what we can do right now to reverse this and to back things up? Yeah.
So how many people really do have PCOS percentage-wise, you think?
So it's estimated 1 in 10 have PCOS. And that, it's around the same estimate as those who have endometriosis. So that's not an insignificant amount of women walking around with this. We are not screening everybody. We're not teaching medically accurate sex education so that people actually understand that they need to go to the doctor if their period isn't regular. It's important to understand too that periods, if you start your period, it can take a good year for it to even out. And for you to have basically it's like learning to dance. The brain and the ovaries are learning to talk together, and nobody expects that we're gonna be like, we'll just put you on Dancing with the Stars. Like,
Right.
oh, you have legs, let's go.
Yeah.
Like, and that you won't fumble. Like, it takes a bit to learn the steps to get that worked out. And so that's not totally abnormal if you're a young teen that your initial period is like kind of wonky
Spotty
for
and
a bit. But if it's going on for like more than a year, you should get it. And honestly, if you're like, yeah, this is like, you know, it's coupled with other symptoms. So like it's incredibly painful, or you are suddenly getting cystic acne. We don't just get acne because we're teenagers. Yes, our hormones are involved, but if it's bad, you know, and you're getting it on your face, on your chest, on your back, like that needs to be looked at. Is there something else going on?
That's kind of like we were talking about in our ED episode with a urologist about how like ED is like, it's a thing itself, but it's also usually symptomatic of something else wrong.
And if you have a horrible period, you might be really happy if your period goes away. I've had those patients and they're like, well, my period was horrible, so I'm so glad it's gone away. And I'm like, listen, there's a reason why ACOG, which is the American College of Obstetricians and Gynecologists, have deemed it the fifth vital sign, because it's very telling of what's going on with your internal health. And while you might be like, great, my uterus isn't building up and shedding lining every month, your hormones are also not protecting your bone, your brains, your heart. And this is where we see, like in female athletes, where they start getting stress fractures in their feet. We'll see a lot in ballerinas and gymnasts, where they're like, they didn't do anything that would warrant a break, but the bone integrity is not there. And so just the stress of being on your feet can cause these little hairline fractures. And so what we're looking at, you know, I think so often, and I was totally guilty of this in my younger years, of being like, that's an old people issue. Like that doesn't affect, you know, those old people issues, they actually started in your teens, which is like, sucks, because like we had no frontal lobe, and like that's just not fair. But it's important to recognize that, like, in your 20s, if you're not having optimal hormone health, if you don't have that optimal estrogen, then you're setting yourself up for osteoporosis, which is more than just like having brittle bones. It's like, you know, having bones that are breaking around your spinal cord, suffering a hip fracture, and knowing that you are increased risk of dying because of having a hip fracture within a year. Like your mortality and morbidity is increasing with these things. It's also, you know, as you were talking about ED, when I was getting my nutrition degree, they'd always say ED is cardiovascular disease until proven otherwise.
Right.
Like that could be the first sign. So that's like something for like the 20-something-year-old males. If you're starting to have issues, yes, it might be psychological, it might be stress, it could be these other things, but anybody who starts there with a, like, it's in your head approach, you need to run.
Get out.
You need to just run and get a second opinion. Very rare for it to happen to a male, very common for it to happen to a female.
Totally. Is there, because like I know a lot of younger girls who got put on the pill early to regulate their period, and that maybe wasn't the best. Like through reading this research, I kind of was thinking, I'm like, am I depressed because I got put on the pill too early? Like I don't really remember having depression before. So are there ways to regulate the period in early stages, like when you're young, that aren't putting 14-year-olds on the pill?
Oh, absolutely.
Okay.
I mean, the first question is why. So it's something that, like, we used to think hypothyroidism was really a disease that started to show up in our 30s, but really was much more prominent in like our 50s, 60s. And now I've seen 8-year-olds with hypothyroidism, and that is going to affect your period. So if that's what's going on, we have to address that piece, because giving you the pill isn't going to fix that. And in addition to that, you know, the pill's not going to fix that, but it may also mask it. And so you're not really understanding a disease that's progressing, that's causing you to gain weight. So this is sometimes, you know, we see in the research, we can't say birth control causes weight gain. We also can't say birth control causes depression.
Right.
We know that there's an association. We do know some women gain weight. I also have a question of, these women who are gaining weight, we're putting them on the pill, did they have PCOS? Which so it's important for people to understand, PCOS can cause weight gain. Weight gain cannot cause PCOS. And yes, there are doctors out there who will tell you, if you just lose weight, you'll cure your PCOS.
Ugh.
And I'm like, if you just go back to the 1950s, you'd be a better fit there, because we don't talk to women like that.
Yeah.
And so, you know, it could be a PCOS issue going on. It could be an insulin dysregulation. So like a prediabetes picture that was going on. Birth control can lead to increased loss of insulin sensitization. So we can see more metabolic issues while on it. It could be that you had a hypothyroidism, and all of those issues can lead to irregular periods. So we've always got to figure out why, but there's lots of things like making sure that we are getting enough calories. I don't know about you guys, but I thought it was not cool to eat at school once I was like a teen, which is when I was like having my period. And I was like, if I'm going to eat anything, I'm going to eat like crumb donuts for lunch, because that, like, what, why? Like, this is why I'm like, I don't judge anybody about their diet, because I call it metabolic obscenities. Like, I've literally committed metabolic obscenities with what I'm putting in my mouth is cussing at my body.
Yeah.
Like, that's what it was like. So, but
that's what I've been doing here. So much fast food.
2020 has been like metabolic obscenities year to shine. It really has. And I've seen people out there being like, if you think that just because you're home and quarantining and you're like feeling sad that it's okay to like eat the cake, like you're wrong and you need to get back on the wagon. And I'm like, eat the cake, yo, because 1 in 3 have anxiety right now. And like, we don't have any mental health support going on. P.S. No one gave you a playbook to the pandemic. So you're literally living through the first time like anyone has. And like, it's not the end of the world. Like, we just put too much weight on
I've just been saying, it's a pandemic. None of us knew that word before this year. So how are we supposed to know what to do?
We did. It was in sci-fi though. It was like this, like this, like
it was in like
crazy,
Contagion.
Like,
yeah.
Or like, it's just like crazy, like, you know, it's kind of like Sharknado. Like, that doesn't happen, right? Oh.
And we're committing metabolic crimes left and right.
Yeah. But, you know, I want to speak to that piece because like, we do have to look at that you're taking enough calories in as well. So your caloric intake, your energy expenditure. So how much are you exercising? I know that like a lot of teens in my practice pre-2020, their extracurricular activities were just, I was like, this is too much. Like, you're getting up at like 5 a.m. to like do your homework and go to school, and you have all these extracurricular activities, and you're not getting home until like 8, 9 o'clock, and then you got to do homework, and like, you have a life to live. And like, and it's so, and like, I say that because it's all about like, I got to get into this college. And I'm like, that you're like burning out now to accrue debt. And I just don't know if like this is the best for your health with what I'm seeing, but we have to be looking at that piece, but we need to not be stepping into it from this like one size fits all practice of like, everybody has to have this BMI, which is like total bullshit anyway.
Right.
Everybody has to like eat this, diet. I see, there's a lot of problems with like the vegan community coming in to these susceptible young girls and doing this lot of shaming. Like, I saw Meet Your Meat in my 20s. I think I cried for like 2 weeks. I just like could not even handle it. And yet like a vegan diet, well, it may work for some, it doesn't always work for others because, you know, we're talking about a population that might not even be like having their like veggies dialed in. Like, and now they're just like, what are you eating? So there is no one size fits all here with the diet. We have to look at, you know, what is actually working best for the individual.
And that's why it's important to do it with a doctor.
Yeah. And then looking at a doctor who's trained in nutrition. I want to caveat that because there's loads of doctors out there who have zero nutrition education. I'm very unique, and that's like where I started. And so, but there's some doctors out there that are like, diet doesn't matter. And it's like, you're thinking like you eat something and it literally becomes part of who you are. Like, that matters. Like, this, how can it not matter?
Were you studying that before you were misdiagnosed?
Yes. Yeah.
Okay.
So I got a degree in nutrition. Yeah.
Okay.
And then going to, because like the big thing about like PCOS is that my doctor was just like, well, you came off the pill. It can't be the pill. And as it turns out, as I write about in On the Pill, there can be what's called an androgen rebound. So basically the pill is suppressing testosterone function. That's why you're like, oh, I got on this so I could have sex, but literally don't even touch me. I'm not even interested. Yeah. It's fun.
Yes, so we all have testosterone. I know that's blowing some people's minds, but I'm very high T, and that's why I'm so horny.
Well, and it's not just that. I mean, testosterone is part of your mood. If your testosterone is too low, you're crying all the time. Your testosterone, I call it like the wake up, kick ass, repeat hormone, because that's literally you being like, I'm strong, I'm energetic because it's involved in your energy as well. I'm going to set my boundaries, and it's a very, very important hormone. It's very important for immune system regulation as well. So testosterone does a whole lot in the female body. And I really hate that we have like, these are the male hormones and these are the female hormones. It's all about ratios.
Yeah.
It's just about ratios and like what are predominant and then how do they express. So when you come off of birth control, your ovaries are basically like, yippee, we can finally make testosterone. You can get this androgen rebound where now you're shooting up testosterone. That can lead to the oily skin. That can lead to the acne. I didn't have any, hair growth on my chin, chest, or abdomen. Thank goodness. That's hirsutism. It's horrible. I feel for you if you're going through it because it's.
What's it called?
It's called hirsutism. And so we'll see this in PCOS, that thick black coarse hair that happens on your face, or it can happen like around the areola or sometimes on the chest. And then we can see it. That little happy trail can become very happy and overgrowing. And one of the worst things you can do is shave that. It really has to be treated with electrolysis, and then you come in and you really work on the testosterone piece. If it's PCOS, we have to work on blood sugar because it's insulin that goes to the ovaries and tells the ovaries, let's make more testosterone, which is then in turn going to lead to this ovulatory dysfunction. So that's the, the other part of the criteria is that we've got ovulatory dysfunction taking place in getting this diagnosis. So with that, that's usually because insulin will talk to the ovaries. The ovaries are like, let's make testosterone. And then we are not ovulating, or it's just coming in, it's touch and go in terms of ovulation. So, with me, I definitely see why my doctor thought like, oh, the pill must have been causing you, like hiding your PCOS symptoms, because it can hide the reproductive hormone PCOS issues. And it just didn't fit the symptom picture. Yeah. I also ended up just going to a lab and getting like all my blood markers drawn as well, which were all totally normal. I've never had blood sugar metabolism issues, especially for people who knew that I had COVID. That was like, everyone's like, she must have diabetes. I didn't know it. I'm like, I've worn continuous glucose monitors. Like I like monitor my blood sugar regularly. And I'm like, I've never had issues with my, my blood sugar being a problem.
So what was
and that's because, what's that?
Like if it wasn't PCOS,
it was really, it was Dr. Brighten who's coined the term post-pill PCOS, where it looks like PCOS after coming off the pill, but it's not actually PCOS. Okay. Which I think is a great term. I talk about it in my book, but I realize some people have confused it and they're like, the pill causes PCOS. I'm like, oh, wait, no.
Yeah.
No. The pill doesn't cause PCOS. It can, when you come off, it can cause you to look and present like you have PCOS. But really, it was just post-birth control syndrome. It was the collection of signs and symptoms arising in my body. I had suppressed and messed with my HPO axis, hypothalamic pituitary ovarian axis, for 10 years being on the pill. And when I came off, my period didn't come back. It didn't just come right back. Like I was told, so many times when I asked about fertility, and they're like, you'll just come off and you can get pregnant right away. No. Because I couldn't even ovulate right away.
Yeah.
And so I had to spend time, thankfully I had a nutrition background. So I just really looked at like, okay, like I need to be getting zinc in. That's going to be helping with my acne. Birth control depletes zinc. It depletes vitamin A. I need to get those in. It depletes B vitamins. So like folate, B12, B6, B2, those are really important for reproductive health. So I just started looking at like, okay. And at the time I was a vegetarian. And I transitioned to a copper IUD, which after that was like in the future. But that was more like, 6+ months later, but I was a vegetarian at the time. And so I just really I was always great about eating like 6 to 9 servings of vegetables a day, but I just got more dialed in on healthy fats and like making sure I was getting quality fats in. I was implementing something called seed cycling, which is a practice of eating seeds. Because I didn't have a period, I matched it to the moon phase rather than my menstrual phase, though it was absent. And then I used herbs as well. Cool. And so I brought in a lot of these things I talk about in my book, because at the time I was like, I'm a freak. Something's wrong with me. Nobody talks about this. And then when I got into clinical practice, I was like, oh my God, there's so many women.
So many other people. Yeah.
Yeah, so utilizing things like Vitex and having that come in, leveraging things like the brassica family to get more DIM in. But Vitex was definitely very helpful
What is
in my
Vitex?
journey as well. It goes by chaste tree berry. And so it can help with that brain ovarian communication. So women will use it to help with their progesterone levels. They will use it to help with fertility. And it really just supports the body in what it's designed to do naturally. And it's something I love Vitex. And it tastes awful when you have it as a tincture, which is what I was doing at the time. So I formulated our Balanced Women's Hormone Support Supplement. I'm like, we're going to put this in a capsule because it just tastes awful. And bring that in. And a lot of the stuff that I have in like our balance, and then our adrenal support as well, because supporting the adrenals was an important piece. I didn't want them. They can make DHEA. That'll push into testosterone as well. I didn't want them thinking they should be joining the party. But those things like rhodiola also taste awful as a tincture, but it's in a capsule instead. It has a little bit of like
I have some
licorice
tinctures that taste awful, but I still drink them.
There's something to it. I think that when you taste it, there's that extra like brain connection to the taste. I do believe that. And yet I also see compliance is really low, because there are people that like, there are people that like, they're like, I can't even eat grapefruit. It's so disgusting. Like the flavors.
Totally.
And like, I'm like, okay, how do we get
But sometimes when something tastes bad, like a medicine, or like if it like stings when you wash your face, it's like that hurts so good. Like, it's working.
Yeah, right. I know exactly what you're saying. I used to like, when I was trying to get pregnant with my son, I was taking Vitex, and I would be taking it like in the car on the way to clinic, and like just drink out of the bottle, and I'd be like, oh, that's so bad. But I'd be like driving my car being like,
it's working. Yeah. I love, just when you know it's working. Yeah. Although there are products, I will say, that they smell fantastic. They don't sting. They don't do whatever. And they work too. Manscaped, I don't know if you've heard about these. They are the best in below the waist grooming. I have always had difficulty with below the waist grooming, with stuff stinging, whether that's like witch hazel to get rid of like ingrowns or something like that. It's never felt good. The stinging, the itching after a day of regrowth or 2 days of regrowth or whatever. And I love Manscaped and their products so much. They offer precision engineered tools to provide you with the best experience. And it's the holiday season, so it's time to buy gifts for you and the person in your life with hair on their body. I'm talking about the Manscaped Perfect Package 3.0. It includes everything you and your person need to keep them trimmed, cut-free, and smelling nice down there. I'm telling you, for my boyfriend, I have enjoyed this so much. The package has the Lawnmower 3.0, a trimmer, the best trimmer on the market for your balls, butt, body, vag, armpits, anything that you would normally take a razor to, use a trimmer with if you get ingrowns. I've been using it so much. The package also includes the Crop Preserver, a ball deodorant, and Crop Reviver, a ball toner to maximize your ball hygiene routine. If you don't have one, get one. Ben has added it into his, and it's like, I love. The products smell great. Their scent is attractive and will help spice up the mood. Finally, the order comes with a pair of boxers to keep him smelling fresh down there, or you smelling fresh down there, or whatever. It is a perfect gift for you and your man or whoever you're dating. Anybody with body hair that like doesn't love all of it. And I'm not saying remove all of it. Just remove what you like. That's why they have the precision trimmer, just to remove specific areas. I've been styling. Literally, I hate shaving. I resent it a lot, especially when like sex doesn't happen. There's nothing worse than like shaving your whole bush, getting razor burn, and then like you don't even get fucked. With Manscaped, I don't have a moment of guilt anytime I do any maintenance. It like always looks perfect. Everything smells great. And we're totally obsessed. Gonna get these for gifts for like a lot of the people in my life who struggle with like hair removal because it's just a one-stop shop. So to get 20% off and free shipping off your order, use the promo code HowCome at manscaped.com. That is 20% off with free shipping at manscaped.com with promo code HowCome. You guys are going to love it. Okay, let's get back to the episode. So we've kind of addressed this, but what are some of the most common things that you are treating besides hormonal health?
Autoimmunity.
Autoimmunity.
So yeah, when it comes to women's health, I mean, yes, we've all experienced a hormone imbalance at some point in your life. You've definitely experienced it because that's life. And we are, as women, very sensitive to our environment, very sensitive. So pandemic periods are a real thing right now. But autoimmunity is one. Autoimmunity, it disproportionately affects women more than men. In part, we think because women have such robust immune systems, we experience illness in a different way than men. And at the same time, we also know that our hormones, they fluctuate. They all interplay with our immune system. And then, on the flip side of that, it's also that autoimmune disease can affect our endocrine system. Yep. So the most common autoimmune disease in the United States is Hashimoto's thyroiditis.
You know who's got it? My sister Charlotte and our cousin. We've got so many Hashimoto's gals in our family.
So are you getting tested and monitored?
No, I should.
You should, because also, a sign of a symptom of hypothyroidism is depression.
Oh,
so
what
it's
up?
A good thing to look into.
Yeah.
Yeah. And so, it's something that I like to screen annually in women because I just find so much thyroid dysfunction. And if I can catch it early on. So let me back this up. With Hashimoto's, and if you have hypothyroidism, odds are you have Hashimoto's, because it's been estimated, there's been estimates of 90%, estimates of 97% of hypothyroidism actually caused by Hashimoto's. And you can diagnose Hashi's with a TPO or thyroglobulin antibody test, but if it's negative, you have not ruled it out. It just means you haven't found it. It doesn't, we have to see it. It not being there could just be the state of your immune system. So with that, these antibodies flag the tissues for destruction, and then your immune system comes in and actually destroys your thyroid gland. This is different than Graves' disease, which causes hyperthyroidism, where antibodies latch onto your thyroid and stimulate it to make more thyroid hormone. This is, you're literally
That's the one where you lose a lot of weight, and hypo is where you gain.
Yeah, but hypo initially, there can be these ebbs and flows initially of having hyper-like states. So anxiety is not uncommon, but yeah, we can see unexplained weight gain. You can have hair loss, dry skin, irregular periods, missing periods. You can have constipation. You can have cardiovascular issues, like your heart can beat slow if you're hypo, but if you're in the initial phases of the autoimmunity really ramping up, then we can also see palpitations, racing heart. So it affects every single system in your body. And so it's important just to recognize that, if you, I think it's really easy for us to be I'm getting older, so I'm gaining weight, I'm tired, I'm, having a sad mood because I'm not where I want to be in life. You still should get that checked out, especially if you're so I actually have Hashimoto's. And when I was early on getting it under control with medication, I was I remember I was in San Diego at a wedding, and I had to I was in a coat standing in the sun shivering. I was so cold. Yeah. And I was I feel like a lizard person. But I shouldn't say that in 2020 because apparently people think lizard people are real. Yeah. I say that because lizards don't thermoregulate in their own body. They have to go out into the sun. I live in Puerto Rico. I just hang out with iguanas all day. So with that though, I see a lot of Hashimoto's, a lot of hypothyroidism. And then there's other autoimmune conditions I see as well, like lupus, rheumatoid arthritis, Crohn's disease. And a lot of that is because these women come to me and they'll have their rheumatologist, for example, or their endocrinologist who's I'm managing your autoimmunity, but these other issues, their endocrinologist, these period problems, we're just gonna put you on the pill. And they're okay, so they come to me and I explained to them that like their hormones are very much intimately tied with their immune system. And so we have to be looking at those, and getting your hormones in balance can help with the autoimmunity, and getting the autoimmunity in check can help with the hormones. And it isn't a one or another approach. We really have to be doing them both at the same time.
Totally. Yeah. It's interesting because like a lot of your research and work is with hormones. And when you think about hormones initially, like you just think about puberty and going crazy and like being emotional or whatever. But like, it's wild how many things hormones really do control in our bodies, and they're really not given like that respect. You know, like I don't know, there's just something, maybe it's a judgment from society, but it's like, oh, hormone imbalance. Like to me, that immediately I think of like crazy. You know, the way that some like women's like hysteria, you know, like just the way that vulva owners have been treated historically.
It's so true though. I mean, and it still plays out now. I mean, you'll hear people say like, oh, and it's this narrative in society that like your hormones are ultimately betraying you. They're just going to make you crazy. A woman can't be president because like
she'll get her period.
She'll get her period and blow up the world. I was like, no, actually she'd get her period and she would be like, chill. It's not PMS phase. And she don't want you in her business. So get it right. If you're going to like play the joke and diss someone, like let's at least be accurate in how we do it. P.S. I think 2020 has shown us that women leading kick ass.
Kick ass.
Yeah. And the reality is that all that information we got is like super, super wrong. It's just dumb. Like I just am like sad for those people.
I'm sad for
they
us.
think that way.
Yeah. I'm sad for having to grow up thinking that way.
Oh, I know. I did too. I mean, it's like I remember just being like, oh, I wish I was a man. Like it'd be so much easier. And now I'm like, no, my hormones literally give me superpowers, and my brain works so much better than yours at certain phases of my cycle. And like when you really start to tap into like, my goodness, like my body, like, and it just like, if you do feel like your hormones sometimes make you crazy, let's just like take a moment to remember that you have the power to create human life within your body. You gestate it, you birth it, which is like I don't care, Iron Man, come at me, like birth a human. Let's see you birth a human.
Yeah,
that's
cool little
enough.
glowing heart. I made a person.
And then you can feed it with your body. Like your breasts adapt to be able to feed and sustain this organism. And you are literally the creator and caretaker of the entire human race. Like your body.
There was a TikTok I saw about, we're talking about like women can't be president because of their periods or whatever. And they're like, they're too hormonal. They're too hormonal. And this girl goes, you know what hormone comes to us on our period? Testosterone. That's the one that you always have flowing. It's like, if that's the thing that you think is a problem, like, well, then you can't lead for the other weeks of the month.
Yeah. And so people understand that when your period comes, your estrogen, progesterone drop because the signal is that we're not pregnant. And then your uterine lining sheds. Then at that point, even though your uterine lining sheds and you're on your period, your ovaries are already making estrogen. So just because we're on our period, because that was, I think I actually commented on that, and I was like, I actually have estrogen pumping out too.
Okay.
Well, but here's the thing about estrogen. Estrogen is helping the corpus callosum, which is what is down the center of your brain. It's helping left and right lobe actually communicate, and it strengthens it. You're better at problem solving. Like on our period, we are better at like planning strategically. Like there's a lot of things. And in that follicular phase, as you're ramping up, like, yes, your testosterone starts to climb because it wants to put you in the mood before you ovulate so that you capture some sperm, because your body's tricky like that. We just have to be like, I know what you're doing and I see and I will take all the benefits, but I also am not giving you any sperm during that time because I know what you're up to. That's how we avoid pregnancy. It's if you want to get pregnant, that's the time. You're like, oh, wow, it's like about 10 days after my period, I'm getting in the mood. Like, wow, I have like this fertile circle.
Start collecting that sperm.
Collect it. It'll live like 5 days. Make your little collection. Put it on a shelf. Present it to the egg. Be like, who are you picking today? But with that, like as that testosterone is rising too, and that like testosterone can start rising while you're still on your period, depending on the length of your period, and your endurance is going up. You can actually sleep less. You have more physical stamina. There's like a lot of things going on. Where it is, because people will be like, never get on social media on your period because it's the worst. I'm like, actually, 2 to 3 days before your period, don't get on social media, because that's where neurotransmitters are shifting. That's where your progesterone levels, if you're having PMS, your progesterone levels are coming down. Like that's usually what's going on. Your estrogen is higher. She's a big old diva, like irritating, like your brain to be like irritable. And then your progesterone comes down. You can feel like more anxious, but in none of that are you going to be like irrational. Like, are you going to be like, and that's the thing that I'm like, I think that men, like, this is really just like ultimate level gaslighting, is that they're like, you're being crazy. No, I'm sick of your bullshit and I'm calling you out on it, and I'm not going to stand for it. Oh, you're crazy.
No, I'm in my clearest mind, and I just did an amazing argument, and your only rebuttal is I must be on my period.
Absolutely. We hear that all the time. And I'm like, if I could go back to my younger self, I would be like, you know what to say? Like when they say that to you, you know what? You wish I was on my period right now, because I'd be a lot nicer to you.
Also, not to dredge this up from 2016, but Hillary Clinton doesn't get her period anymore. And if she did, it would have been a miracle.
Right? Oh my God. When I saw that, I was like, you literally fell out of the stupid tree and hit every single branch. Like on the way up. When people are like, she's going to be on her period. And I'm like, what state are you living in? Because I need to go talk to your legislators, because your sex ed in school is so bad that you don't understand this. So I guess I shouldn't be judging them too much, because they just like never got the accurate education to understand what happens in menopause. But then they think like, oh, we go crazy in menopause. At that point, you are more matched to the male body in menopause. Like you are not cyclical anymore in terms of like the hormone fluctuations. You are, even your immune system starts to shift to be more like a man. So it's a little weaker because it's more like a man. But in reality, that is true. I'm just being funny here, you guys. I'm married to a man. I birthed a man. I'm not hating on that.
You could also, we don't want to be too gendered, because a lot of you have problems.
For sure. Well, I've been like mindful and like talking about like certain aspects and then there are things that are like, it's so tricky. I find that so I've had many transgender patients. I've worked in a transgender clinic, and yet it is such a tricky thing to navigate, because there are very specific women's health issues that if I find it, and I hear women say, we're fighting so hard just to get research in PCOS, just to get the basics of what we need in medicine. And when we bring in this additional layer, and especially like when you're talking to these politicians, like it just like muddies the water. But I do think we do need to be mindful. I know people on social, when I say menstruators, will get like, there's these people who love to say like, don't make women a 4-letter word. And I'm like, what, why would that be a 4-letter word? It's not 4 letters, but also
but there are people who menstruate who aren't women. Like we know that.
Absolutely.
And so it's interesting. There'll be people who will get offended if you say women. There are people who will get offended if you say vulva owners. There are people who will get offended if you say menstruators, womb havers, whatever.
Yeah.
But we're just trying to be accurate and get people good medical care.
Yeah. And it's a lot of layers to that, right? Because talking about a trans woman's health needs is very different than talking about like, the typical society's concept of a woman, like in terms of all of that. And it's something too that I find tricky, because people will say like on your social media, you should use more inclusive language. And I'm like, so I am bound by what the study actually said. The study did not study trans women. It did not study trans men. This is who the study actually studied in this. And there are things that like when you start talking about hormones that you need to transition, it's a very, very different dialogue. And I wouldn't be like, oh, okay, you're a trans woman, just take Vitex. No, that's
Sure.
inappropriate. So there
Sure.
are times where it feels exclusionary, and yet it needs to be, because it would be unsafe
Right.
to be making
Right.
such broad generalizations in that way.
But
So
from like a bedside manner perspective, I think you've
oh,
been
yeah.
doing like an amazing job where it's all about like believing the person in question and being like, this pain is valid when you come in and say that, or this feeling is valid, or like we need to work. And that's what a lot of things that vulva owners and women struggle with is advocating for their best health and having
Mhm.
healthcare workers who really believe them and can like work with them. So what advice would you give to women or folks with vulvas who are struggling to do that, to advocate for their health?
100%, you are the only person living in your body.
Mm-hmm.
So you're the only one who knows what's normal for you. So you have to advocate for
Mm-hmm.
yourself. Doctors, whether they intend to or not, are definitely good at gaslighting. And because they come from this position of authority, they can make you question what's actually happening in your body. So take notes on yourself. Write them down, whether it's in your phone or notepad, whatever you like, because it's very hard for someone to convince you that you are not telling the truth about your own body,
Mm-hmm.
or your experience is fabricated, when you actually have documentation in front of
Mm-hmm.
you. And well, it's awful, because the worst thing is to be sick and to need help, and then to finally, and like also like the things that we need help with, we don't always want to talk to anyone about. And then you muster up this courage and you go to the doctor, and then the next thing you have to do is you have to really, I mean, I have patients who say like, when I go to my doctor, I'm going to war. Like that's the energy I bring. And I'm like, that sucks, because you're already sick. You already don't feel good. And now you've got to rally
to fight
for this.
with someone who's supposed to be taking care of you.
Totally. You know, so like in my book, in chapter 4 specifically, I have the, like, if you have this period problem, these are the things that are worth investigating. And what I tell people to do is to take that information and go to your doctor with like curiosity and really the mindset of like, they do want to help. And why that's important is because doctors are people too. And if you bring, like, I have patients that are like, I went to my doctor and I was yelling at him, and I'm like, ooh, did he run out of the room? Did he shut down and stop listening to you? Did he yell back at you? Because that's fight, flight, or freeze. And that's what happens. That's a sympathetic response that all of us go through when somebody, it feels like you're being attacked. So it's really going to your doctor and saying, you know, for example, I'm having heavy periods. You have to quantify that. Like, how do you even know to do this, right? This is why I do what I do. So I'm bleeding for 8 days out of the month. And, you know, for 3 of those days, I'm changing a tampon or pad every single hour. I have to wake in the night to change that, you know, or I'm having to double up on menstrual products, whatever that looks like for you, quantify it. You know, if they say, oh, okay, well, we can just start you like on birth control, or like, oh, let's monitor it, or that's normal. Say, you know, you can say to them like, you know, and these are my cramps, you know, I'm just wondering, like, is it a possibility I could be anemic? What would you think about doing a CBC? Is there a possibility I could have fibroids? Like, what do you think about doing an ultrasound for me? And really coming with the, like, is there a possibility? And what do you think about doing this?
You have to be like a little doctor for yourself, it sounds like.
Yeah. It's unfortunate, right? There are doctors who will play ball with that. There are doctors who will just deny you and say, no, we're not going to do anything. At that instant, what you need to say to them is, I need you to document in my chart my request for this lab, your reason for denial. I will be requesting a chart note. Everything that is said in the visit is to be documented in those chart notes. And I will tell you that, yes, that can sometimes get a doctor to do the testing. It may not be warranted. There might be a good reason. And for them to write that down, you're actually getting it explained to you. That's fantastic.
That's worth it too.
There's sometimes but other times, you know, there are women, and there are stories like all over the internet of this, but I've definitely had patients as well that are like, because I did that, I had a patient, you know, I referred her to her OB-GYN. I was like, we need to do an ultrasound. This patient's having, you know, changes in their bowels, all this stuff. OB-GYN didn't like me, didn't like that I was making this referral, just told the patient not necessary, all this stuff. She went through that. I need you to write that down. We got a referral to the next one. Turns out she had ovarian cancer. So
wow,
it's a situation where, like, it's really unfortunate. I actually just did this TikTok because I came across this gal who was raped and then got her medical
Yep.
bill. And I am so pissed.
I was going to bring this up because
Yeah.
that I've been seeing those left and right.
Yeah.
And Robin and I have been discussing healthcare a lot and how, like,
Yeah,
you know,
because
where she
Robin's
is.
in like Australia and she's like,
New Zealand. Whoa, whoa.
oh, damn. Oh my God, that is like the worst faux pas. Oh my God, Robin, forgive me. My God.
Whoa. But yeah, they get their stuff for free, you know, and then we see all these TikToks of women. Sorry, just you go on. Say what you saw.
I was just saying, yeah, there was like so many Australians who chimed in. So I thought of Robin and geez, I know. There're gonna be some like, and I actually have family in New Zealand, and if they listen to this, they're gonna like
No, I'll cut it out.
bitch slap me through the phone. No, you don't have to. You don't have to cut it out. It's okay. Guess what? I may be a doctor, but I make mistakes, and then I will own that.
Yes. Go, girl.
But no, on the TikTok coming across that girl getting her medical bill, and I just was so upset, and I wanted to cry. It just should not. This should not be a thing. And like, and that's the thing is so frustrating is that
It's not even just it's a TikTok trend.
it's a TikTok trend
of survivors sharing their ambulance bills, sharing their hospital bills.
Yeah.
And it like the amount of trauma to just go through a sexual assault to begin with, but then to be charged for it, to have to keep reliving that memory. Like,
yeah.
Are they charging for the rape kits too? Apparently.
So I'm not like, that's something that I'm not actually sure. I don't work in an ER and I that's not my arena, but that was a question that I had in my mind. But you know, I did they have that like stitch. It was my very first time using that stitch feature and I couldn't not do it. I was like, I have to. And then I actually sat on it for like a week, I think. And I was like, okay, am I ready? Cause I'm like, you gotta get ready for the hate that's going to come. Which my husband and I were just talking about how ridiculous it is to know that like some horrible human out there is going to come on and be like, you know what? She deserved it and she should have to pay.
Of course.
Horrible.
Of course.
Which then I just have to come in and just be like, no, just stop. Yeah. But you know,
there's some horrible pro rapists on TikTok.
Oh my God. Yeah. I've called them out quite a bit. But I just made, I just asked like people outside the US, does this happen? Like, have you ever experienced this outside the US? There were women who shared, like I was raped and I paid $6 for parking, like to go to the hospital. Like that's it. Like there are women who shared very candidly their story. And so many of them are like, I just can't even believe this. And I'm like, it's deplorable. It's absolutely deplorable. And I feel like for every person who fights against universal healthcare, they just don't have the understanding and the education that what we're talking about is a healthier society as a whole and not going bankrupt because bodies do fail. And it actually, and I find so often people who like fight against it and are like, yeah, we shouldn't have this. And yes, they don't understand it. And they also don't understand that like, they're not in the tax bracket that would actually be affected tremendously. And that's something else like they just don't understand. But it's so frustrating as a doctor. Like there's so many of us who are just like, there's nothing that we can do about this.
I don't know about other places in the world, but I feel America is a very like, it's cool to be mean. It's cool to not care about other people. And you're weird if you do.
Yeah.
And I feel very slighted growing up that way and thinking like, I do remember thinking, oh, well, why should people get free healthcare if I have to pay for my doctor? Well, shut up. You can afford it. You know what, like, what is that taking from you?
Yeah.
This recently, there was news about college debt being forgiven.
Oh, yeah.
And I noticed my growth in that I was like, oh, great, that's wonderful. But then I saw other people going, well, I had to pay for college. And it's like, well, fuck you. You could afford it.
No. I had to pay for college. And in my day, it cost me $10,000. And I was able to work summers and pay for it. And it's like, that's really cute. Why don't we bring you up to speed rather than talking first? Why don't we listen first and have some context about what you're saying? Because I've paid off my undergrad, but like to be a doctor, I'm like, I don't see future gens wanting to be doctors with the debt that we incur.
Right.
That like, you don't become a doctor because you're like, I'm going to be making all this money. You become a doctor because you're like very passionate about helping people. You love the science, you love the, the human body. there's all of these other aspects to it. And yet, and it is like sometimes, especially my friends who work in hospitals, it is like such a thankless job at times, where they're being overworked. Hospital administrators are making way more money than them, way less education. And we see the suicide rates among doctors just climbing. And then we've got this debt that's just like looming over us.
How do we think anything's going to be okay if we do this to people? If we're literally burning everyone's candles at both ends, it's like, come on. And okay, wait, this is a very teeny aside, but since I do have a doctor here, my dad's a doctor.
Yeah.
And he used to think of like a Teach for America model, but for doctors. Like you get your medical schooling for free, but then you have to work for the government. Do you think that could work for us?
You know, I really don't think it would work unless we did have like universal healthcare and things along the line. The tricky thing too is that like, I'm not anti-US government, but they don't have a great track record of like just caring about their citizens.
Right.
And that's something that like, you know, you look at like some of the doctors who are working for the government at the border right now, who are performing unethical hysterectomies on immigrants. Like, is that what that would mean? Is that we have to put the government first and first do no harm and the patient's needs come second? So it is something that
that's a lot of harm, removing someone's uterus, you know,
a lot of harm. And it is something that like, I mean, when those ads were going around, there was something, I remember like when the ads about like working at the border and like we were all discussing it, and there was something in it that was really questionable, because it was like, you basically put the philosophy and the beliefs of this administration before like your philosophies. And I was like, are you saying that you have to put the philosophies of a political party above the universal philosophy that is the doctor-patient relationship is sacred? You must first do no harm, and it is the patient's best interest. And then to hear about these women having hysterectomies, like I'm Mexican and Native, and this is my lineage. This is so much of, it's really been in recent years recognizing why I'm so passionate about this, is that these things have been done to my family members. There's been forced sterilization. There's been coercion and lies about birth control, because heaven forbid a Latina have like more than 2 kids. She's such an unfavorable burden to society. Like there's just so many of these things that it's like, it's just so tricky, right? I love the idea of like, like I would have, like if I have friends who went to work for nonprofits. They were told that after 10 years of a nonprofit, they would get their student loans forgiven. Nobody's getting their student loans forgiven. Like they went to 10 years with a nonprofit, making less pay, with the idea that they would get their loans forgiven. And that's, the government's not even keeping their word on that.
That's fucked up.
So it's just I wish I had a really great solution. I mean, the solution I see, I think the UK has it worked out a lot more in terms of like doctors are not paying for their college like we're paying for here in terms of their education, and they're making less pay. Yes, that's true. But we've also got this system of universal healthcare. And is it always the best care? No, it's not always the best care, but it doesn't mean that like, if you get in a car accident or something unforeseeable happens, if you need to have like screenings,
you get raped.
If you get raped, you do get access to those things. And I will tell you, you know, my son got sick in France, and that was something that I was like, we don't have insurance here. My insurance in the US wouldn't have even covered like any of this. It was, I mean, so when I was living in the States proper, it was like $15,000 deductible for him. And I was like paying, I think like a couple $1,000s a month for health insurance. I was like, I'm paying like a typical annual salary of someone just to have coverage here. And I don't even really have coverage. But in France, what I thought was really great, yes, it was cash pay. Yes, it was much, much cheaper than the US, like significantly cheaper. We just happened to be there when shit hit the fan. So, but what I thought that was really great is that you were told ahead of time how much everything cost. You were given like printouts of things. You knew walking in how much things were, and you could budget and you could plan for that. We did have to wait like, gosh, what did we wait? We waited like almost a month for an MRI, which when the doctors are saying your child might have a brain tumor, That's a long
wait.
wait. So, you know, there are those kinds of issues, but I got the MRI. We came out of the MRI room. The pediatric neurologist came in right away. He spent an hour talking with me through everything, reassuring me, would not leave the room until all of my questions were answered. In the United States, I would not have gotten that long of a visit. I probably would have had to wait a couple weeks to like see the neurologist, and I would be charged for the MRI.
You would have been slapped with all these surprise fees.
Surprise fees for the doctor, for this,
Yeah.
for that, and it was, and
surprise fees are the U.S.'s love language.
I know. Well, you know, and to juxtapose it, like here in Puerto Rico, my health insurance is really affordable for like a family of 3. I think we pay around like $500. I went to the hospital with COVID. I had to have testing. I had to have all this stuff done. And I walked away with like $100 bill. Like,
wow.
I was like, is this it? Like calling the hospital. Is this it? Is there more? Like I had a CT, I had a chest x-ray. I had like, I'm just like, you guys ran the gamut on me. And they're like, that's it. And they're like, do you need to set up a payment plan? And I'm like, this is it? Like, I'm just like, what?
So I will say I had a this is it moment because I've noticed that here in Oregon, people really do try to help each other out.
Yeah.
You lived here, so you know that there's like a little bit of a different vibe. We recycle more than the others.
Well, I loved Portland's compost, like the
me too.
compost.
I went to the recycling place. It was fantastic. But there was a woman at the Fred Meyer where I get my prescriptions, who we like vibed or whatever, and like she was having a bad day and I was picking up depression medication or whatever, and she kind of like was, I guess, looking out for me, and she put this code in that made my pills like go from like $150 to like $8, so that now whenever I pick up my medication, it is $8 for that month to not be sad. And I just remember, like, the first time I got diagnosed with depression and anxiety, I was like, well, I don't even deserve to be here if it's going to be this expensive to go to the fucking therapist. $230 to go to a therapist in New York. Then $150 for the pills for the month. I'm like, I don't even deserve to survive.
Yeah.
Every time I would pick them up, I'm too expensive. And then this one good deed from this woman who just wanted to make my life a little easier, I was like, oh my God, I feel like less of a burden to the world. And like, how many people must feel like such a fucking burden to the world because of their medical issues? And yeah, it's horrible. Like, we need to create like a nicer space for people to feel more comfy and more taken care of.
Well, and you think about things like injectable insulin and how some people have to ration it and they can't even afford it. And you die without that. Like, you know, Lexapro, arguably, like, you're not going to die because you don't have to have that medication.
I'm going to kill myself, but I'm not going to die.
Like, that's the caveat there, right? Is like, arguably, like, you're not going to die because, like, it's not like you were born needing this, and not having this is a non-negotiable, right? Like, that's, you know, what having insulin is like. And yet these people, I mean, it's crazy because, I mean, I think that was a TikTok trend of people just being like, in other countries being like, what the hell, you guys are rationing your insulin? Like, you can't get access to that. Like, what? And it's crazy to me that, like, when I just see people from other countries chiming in and being like, or saying, I moved to the US and nobody warned me ahead of time, like, how difficult this was going to be, like, navigating healthcare. So we've got the difficulty of, like, access. We've got insurance issues. We've got, like, you know, how much it costs. And then we've got, like, will the doctor play ball? Will the doctor actually, like, what kind of, you know, will they actually even believe you? And I think that it's a tremendous, if you got handed a womb at birth, like, you are on a tremendous, you know, uphill battle at times. Unless like everything is going fine. And that sometimes I'll hear people be like, I don't understand what your problem is. And because they've never had a problem. I mean, I've certainly, I mean, I don't diss conventional medicine. I've had to rely on them. I had a miscarriage several years ago, though, and I went through the same thing trying to manage the healthcare and the bills that I got from that. So I lost a baby, and then I got these like astronomical bills. And then just the bedside manner of the doctor, that there was no heartbeat coming up. So I knew what this meant, but he didn't want to be the one to tell me that. And instead, well, he actually had, so transvaginal ultrasound is done with a wand that's inserted in your vagina. So he's actually got a wand in my vagina. He's like, I have a friend that would like, loves women's medicine. Like, would you like be willing to have her come in your clinic and shadow with you? And I'm like, I'm laying on the table.
What?
You have a wand in my vagina. And I'm finding out my baby's dead. And what the
You're asking me for a favor.
hell is going on? Yeah. And it was
ew. Oh, I'm so sorry that happened to you.
You know, these are things that like in the moment it hurt, it sucked. I'm not gonna lie. I'm not gonna be like, oh, I'm so resilient and strong. I like definitely did my ugly cries. And yet I'm like, these things, I'm glad these things have happened because they make me a better doctor and they make me, you know, when I see this stuff out there going on, I'm like, yes. And here's the thing is that it happens to doctors too. Like he knew I was a doctor and yet it was still, this was going on. And I remember when I got the bill and I called the hospital and I was trying to negotiate with them and they were like, well, we'll give you like if you agree to pay cash, we'll give you like a 60% discount. And I said, no, let me correct that language for you. If I agree to pay cash, you will give me the regular rate without the 60% insurance markup. That's what you're saying, because that's what happens is having insurance. They give a markup of like whatever percentage because they've already negotiated contracts that the insurance is going to pay less. And so, we've got a lot of issues to clean up in this country and we really have to have a complete overhaul. It's not even something of like, I don't think at this point we can fix this system. We need a new system because there are too many people in the United States saying this is not working for me. I'm like, if the raft is sinking and you've got all these people saying this is not working and you're like, well, there's some, like, let's just get a patch kit and start patching it up. Like, how long is that going to last?
Boat.
How long? We just need a new boat. Or get those people to some land so they can take care of themselves.
Get them to New Zealand.
Robin's like, you're welcome.
I know we have to let you go soon, don't we?
We do have to go soon.
Okay.
I know Robin's like listening to this conversation and she's like, yeah, New Zealand's amazing. Yeah. Did you see how we're like running 2020? Yeah.
So we were talking about PCOS and how that happens after birth control. Sometimes, what should people who have vulvas know about their contraceptive options?
That there is no one size fits all, and the best choice is the one that you can stick with and works for you. So at drbrighten.com, I actually have a contraceptive guide. It's very thorough. I have lots of articles on there. I also go into detail in my book, Beyond the Pill, and it's really about giving you all the information where in some instances, I'll take the copper ID as an example. There are people out there that, so it works great for some people. For other, like if you have endometriosis, heavy periods, painful periods, it's not for you. Just don't. It's going to be horrible. It's a terrible situation. I know because I did that myself. And I've had patients just as stubborn as me. And sometimes we got to learn the hard way. Okay. With that though, you know, there's people who are like, this led to copper toxicity in me. And I swear I had elevated copper levels. I have no problem saying there are people who report this. And yet at this time, we do not have research that says that it does cause this. The research does say if you have a copper storage issue, then this is probably not the best issue or best form for you. And so that's what I do a little bit differently is that rather than just being like, I mean, we see so often that like when we look at contraceptive choices, like, you know, you take the pill, for example, and it's just like, it's so great. It does all these wonderful things. Here's all the benefits all the time. Then you're like, well, what about the breast cancer risk? And they're like, oh, it's so minimal. But you know what? It's going to help with ovarian cancer and endometrial cancer. Like, no, we need to back it up. We need to talk about
especially if you're somebody who has breast cancer in your line. It's like, okay, that like little negligible percentage is not so negligible to me.
Absolutely. That's the kind of thing that we have to be talking about. And so what you need to have all the information. You need to have the information given to you in the context of your personal and your family history. So, with the pill specifically, if you have a family history of Crohn's disease, then you're at a much higher risk. 5 years on it, a study found, and you're at a 300% increased risk of developing Crohn's disease. That is, presumably you have the genes. That kind of conversation needs to be had. Does that mean like you don't use the pill? Not necessarily, but it does mean that your doctor says, if you have changes in your bowel movements, if you're seeing food in your stool, and takes you through a list of things, I need you to come talk to me because this is what might be going on. This is a risk for you individually.
Totally.
We just don't see a lot of that. We just see that this is the safest thing. We have lots of research. P.S. We do not have lots of research for as long as the pill has been out. It's sad how little research we actually have on this. We get very little funding into contraceptives. So I'm like, oh, the funding on PCOS is so bad, and on endo and all these things. The funding on contraceptives is really, really bad, and it is very taboo for researchers to often even investigate.
And the male contraceptives, they gave up after like a month because they were sad.
Yeah. And, I actually said that on TikTok, and there were some women that were like, no, they had suicidal thoughts. And I'm like, oh, do you want to talk about that? Because you're prescribing it to young girls and adolescents. They can have a tremendous increased risk of suicidal
And we have
ideation.
eating disorders too. So it's like compounded.
Yeah. But then, there's also the issue, we can't say causation, and yet we can also see that there was the Denmark study that showed really high rates of correlation of depression when you started birth control. And that's not just the pill. That's looking at the NuvaRing, the IUDs. Progestin based fare worse. So that's your IUDs, your Depo shot, your mini pill. And that matters. We have to be talking about that. They gave up on it. And let's say they said well, it's not ethical to continue this. Can we please just stand back and say we in the United States have a capitalistic market, and pharmaceutical industries are a business like no other, and they have to have a return on their investment.
Just say
and
it.
If it's making people depressed, if it's making men depressed, they are not going to take it. You just lost your market. Women have always been told, and it's true, if you don't want to have a baby, the burden of pregnancy is on you. It's not the kind of thing, and I say this as a woman who has grown a human in your body, your body does some radical, crazy things during that process, after that process. People, there's people that are like, well, you can have a baby and just give it up for adoption. And I'm like, there's a lot more to this, you guys. There's a lot to this. And so it's a situation where birth control has always been placed on the shoulders of women because we can actually get pregnant. We are stuck with a decision if we don't want that pregnancy, which everybody has an opinion about and everybody shames us about one way or another, right? Because it's all everybody's got dibs to have an opinion on a female body. A male body is a little bit of a different story, but the reality is that the burden does not lie with men. Because unfortunately, there are some really great men, and then there are men who just walk away. They just walk away if a pregnancy happens. So the burden is not on them, and they don't want to feel sad. They don't want to get an injection. So it's something that there just wasn't going to be a market for this. Whereas women, the first feminists actually reject. So birth control's got this really ugly, racist history where, it was non-consensual experiments that were performed on the women of Puerto Rico. And they didn't even know that they were in a drug trial. Some of them died. That was swept under the rug. One of the people involved, one of the doctors was like, this is not okay. I will not be part of any of this. No woman should take this. But, they experimented on the brown bodies, got it to a place where they could market it to white bodies. That's essentially what happened.
Testing and stuff.
Yeah. And this is something that if anybody's part of the BIPOC community, you're going to be like, yeah, this is medicine. And if you are not, and you're like, this is bullshit, go read Medical Apartheid, or really just read anything, a study, because it's all out there that it has been very medicine has been very unethical with BIPOC bodies and women's bodies, and especially women of color. That is something, and we still see that systemic racism carries through in medicine, where we are dismissed more. We are seeing you are more likely to die of certain things because you're just not being heard. There's major issues in all of that. But to understand that when birth control first stepped onto the scene in the States proper, it was rejected by the feminists. And the first feminists were like, no, we've got problems. They brought it to Congress. Those problems were never really resolved. It was just marketed in a new way to say, this is the feminists, like this is the drug of the feminists, and now you have control of your body. Now, did we graduate college at a higher rate with the introduction of the pill? Did we start to see our pay increase? I mean, pay is not increased enough, but yes, we did see that we made gains. So there, as I say all of this, birth control is not all bad. Like, it has helped us, and we were able to take charge of our reproductive health. But it's just also really important to understand that there has just been, this is the very first drug in the history of pharmaceuticals that you did not have to have a diagnosis for. You didn't have to have a disease. You just had to have a set of ovaries and a uterus that could presumably carry a baby. And there you go. And then over time, what we saw is them saying like, oh, and PS, you can just stay on it continuously, right? Like, we don't actually have studies. We don't have long-term studies to know. Then they started saying you could be on it. So continuous, by the way, you'll see like great marketing. There's a company that's doing mail order birth control, and they're like, oh, periods are unnecessary. And like, you don't have to have them, just stay on continuous pill. I'm like, oh, that's really smart for your investors, because yes, they have investors. You're selling more pills. You're selling more pill packs. Like, you're actually selling more products. Like, that's really clever business. However, you need to just be honest about the fact that, Sorry. I was just going to say, we don't have research on that, and we don't have research of what happens when a gal starts menstruating, you put her on the pill, and she doesn't come off until menopause.
Right. We don't know what that looks like. That's what I've gone through so many different types of birth control, and I remember I got off the pill at like 16 because I was like, I don't even know if this is going to affect, can I have a baby later? Like, people put you on and they say, yeah, stay on. But then you start hearing these rumblings like, well, could this make you infertile? And then have you seen any of those?
Yeah, so we don't have any research to say definitively that like birth control can lead to infertility. The way it's prescribed, with like 60%, almost 60% of women using it for symptom management, is likely what is at the root of that. In that if you have PCOS, if you have endometriosis, if you have hypothyroidism, if you have issues with your menstrual cycle, and we put you on the pill and we do nothing about that until 15 years later, you want to have a baby, odds are you're going to struggle with infertility. And your first thought probably will be, it was the pill. I do know there are women who have anecdotally said, like, I knew I got pregnant before, then I got on the pill for a period of time. I was unable to conceive. I was then infertile. Could that be the pill? Could it possibly be birth control? We don't have any research for me to be able to say. There's not enough data. It's one of the biggest things too that like gets slapped down. As soon as a woman questions it, it's like, that's a myth. That's a myth. But where are these myths born out of? And that's what instead of just being like, I'm a doctor, that's a myth, shut up. We need to be like, okay, well, it could be the pre-existing condition. It could be that like we use this to delay pregnancy, and that at an older age, it can be more difficult for some women to become pregnant. It could be that like as we age, we make less CoQ10, and birth control is also depleting that nutrient, and it protects the ovaries, and it's important for mitochondrial health. So like we can talk about like there can be these other things going on while you're on birth control, and that may be lending itself to them. But I think like to this idea. But I think the most damaging thing that we do is we just say, it's like, when your parents say, because I said so, nobody likes it. And that like really diminishes people's trust in doctors. It's like, oh, because I said so. Oh, I'm just telling you it's a myth. Explain to me why you believe it's a myth. But also, can we just be honest in medicine where we lack research, where we don't have the answers, and where we've made mistakes in women's medicine? Because that I see is like such a huge issue, is the ego of the doctor always trumps this, like just owning it. And listen, like I'm in medicine, and I will tell you that its history is ugly. And there's been stuff that I'm just like, I can't even with that.
Yeah.
And that makes me ashamed to be a doctor. But I can acknowledge it. I can talk about it. It's just the same with birth control. I can acknowledge it. I can talk about it. We can have real talks about it. I can tell you this is where we're at right now, but hey, a study might come out in 10 years and I might be totally wrong because I'm operating on this information I have now, and we might have new information.
Science.
That's just called science.
That's
exactly. That's just science. That's the way it works.
That's the whole scientific method.
Yeah. And we there are things that I'm like, we do want to like try to prove ourselves wrong on these understandings. And we do want to gain, you know, greater understanding in what's going on. Like, I'm hoping that like in the next decade or so that we can tell women with endometriosis, like what exactly is going on, and we can have better targeted therapies for them. But I just see that like, you know, too much in medicine, it's very dismissive and it's very, and then you'll just hear like, nope, it doesn't do that. Like, it's totally fine. And you're like, but why do people say it? What are the nuances? Can we have the conversation around that? Because if we can't even have these conversations, I mean, I get to where I talk about like the history of birth control and the problems with that and how it was exploitive. Margaret Sanger is very controversial. Like, if you're in the BIPOC community, she ain't your friend. Like, you are, like me growing up, it was like, I mean, we just had a very different way of looking at things because, you know, she was a proponent of eugenics. And people have tried to be like, no, she wasn't. She was just, when she lectured to the KKK, she was just trying to get them on her side. And I'm like, that's crazy talk to me. But when I talk about these things, like there are people that are like, you're just anti-birth control. That's what's going on. I'm like, you're just labeling somebody to quickly dismiss them. And
because
when you're
that's
doing
harder
that to me on
than
social
learning.
Well, and it's also a situation of like, I'll see other healthcare practitioners be like, don't listen to her. She's just anti-birth control and trying to like fear monger and blah, 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 blah. And I'm like, but you see, like when you shut me down like that, when you start labeling and dismissing and making fun, your patients see you on social media. You're the same person. Like, the way you treat one person is how you are interacting and treating all people. So like, I always look at that and be like, oh my God, I would never want to be your patient because I wouldn't feel safe to like ask you a question. And really with your doctor, there should be nothing that's TMI, nothing that's off the table to discuss. You might bring something that like we know is totally like outlandish and crazy. Because we have a different education than you. We've got different strengths. You've got your strengths. And it's not for us to be like, oh, you're stupid for belief. No, it's for us being like, I can see like how you could believe that. Let me help educate you so that you understand a little bit better so that you don't feel afraid and we can take the fear out of the decision that you're making.
Totally. All right. Well, you are doing amazing work and we are so lucky to be able to have you on this podcast. And I'm sure we're going to have a lot of extra questions for you. Would you be willing to answer some of those questions if we get some runoff?
Totally. And just so everybody knows, once a week we do Ask Dr. Brighten on Instagram in my stories. I try to get to them all. Sometimes I just cannot because there's so many. And if I don't, then, or there's like, oh, this is a really in-depth one, we'll usually make an article at drbrighten.com. So
I love it.
There's a ton of information there as well. It's really, in recognizing that, one, we don't get the education about our bodies that we really need. And two, there are huge barriers just in socioeconomic, climate in the United States to be able to get access to that information. I just try to put out as much information as possible for free so that people can learn their body. I just don't think that you should be walking around not understanding the body that you live in. Like, you just have a right to that. And it shouldn't be basically walled off by medicine saying like, we have to go to doctor if you want to understand. Doctors, like your average doc spends 7 minutes with you. They do not have time to walk you through the complexity of a menstrual cycle.
Totally. Also, where can everybody find you online if they want to follow your stuff? Yeah.
So if you want to see me on TikTok being kind of goofy, or pissed off at times, because that definitely happens too. It's at Dr. Jolene Brighten. That's the same as my Instagram handle. Those are the two main places that I hang out. I do have YouTube videos that you can check out as well. And then drbrighten.com. That's our main hub. And we've got, like I said, we've got a ton of resources there. We've got articles. I even have a medical review panel, which are outside experts who come in and review my articles and put their stamp of approval on things. And they are all practicing clinicians who are taking patients, and I curated it that way so that you can also use that as a resource to find a doctor in your area.
Awesome. Also, I am coming out with a web show called TikTok, TALK, where we talk about TikToks, and I would love to have you on the panel sometime.
Oh my God, let's do it. TikTok is like
my life.
He was so annoyed with me when TikTok first stepped onto the scene, and I was like, and he's just like, why are you watching? And I would get into sounds, and then I'm watching everybody on a sound, and he's like, I can't hear that sound anymore.
Dude.
And now he's like, TikTok is the best social media. I'm like, yeah, we were like MySpace days, and then we went to Facebook, and that was like how you studied in college. This is how old I am, guys. And when people are like, I remember when TikTok was like, not the boomers, and people like, I'm not dissing you if you're a boomer, but I felt the same way on Facebook when I was like, this was really fun.
And now they're invading.
Political, and people are hating on people, and like, what's happening here?
Boomer's
TikTok,
not an age. Boomer's a mentality. That's what one thing I will say is there are so many great old like 80-year-old people on TikTok who are fucking fantastic, and they feel young, and they're zesty and shit, and
they're amazing. And I'll my in-laws are in their 70s, and they're even like, what's with these boomers? Like, to people their age, and I just think it's hilarious. It really is a mentality, because I was actually saying this about someone, like a friend. She's actually a friend of mine, and she's like in her 30s, and I'm like, she just acts like a boomer so often. Like, what is that about?
Some people were born boomer. They were like, what's up? I love the Beatles, and I hate black people.
You're gonna get some boomer comments below.
No, because I don't see you as a boomer. If you listen to this podcast, you're a fucking phenomenal human.
True.
And so are you. Dr. Jolene Brighten, I have to ask everybody after a sexual experience, which this has been, did you finish?
I finished. Yeah.
Okay,
multiple
amazing.
times. So thank you.
Oh my God. Thank you so much for coming.
Oh, that's a good one.
I'm so glad you like that. And we will see you next time on How Come. Goodbye.
Bye.
It's not you, it's me. I try so hard to finish honestly. They say you'll know when you go all the way from A right down to O. Oh no, I think that I still got a ways to go. Oh, I'm sick of this, and I have got to know. How come? How come? How come I can't achieve? How come I can't achieve? I'm rolling up my sleeves. I'm rolling up my sleeves. Oh baby, I believe these guests can help, 'cause I can't do it by myself. I wanna just